viewers, your mama kwaba eba zone 5 health line. And then so Eradia Dom, that one was so, and that's one kwa Erade aye. Today is a new episode. Zone 5 health line. Yeah, the new topic cry eba makwemo. And that question we did pass it. About that. Na combat talk. No, when you bet say obeti sa assembly. Eti chenwaso na twenwani abra ye twa ye ho abe ye ba musonfo Richmond tete na du so na me guess no enso madana di akire mo ye twa ye ho mra ye ba regimedi ni na sese so. Welcome back from this quick commercial break. Where the Zone 5 health line so na when you eguso ya ohwe. Erade adom said the kan Zone 5 health line. Abribia no nsema ewo apomudin ayaresabia onti ase anase nsema efa wapomudin ho ade bia no odwendwene ho obaba eno na Zone 5 health line yenya abotre efa health practitioners anase abode mu nyanza pemu wona wan biye papa yen honam akwa mu yan won sinkunwa ne yenya abotre ne apapa wo senia abribia no ubenya ho nte ase dia abaye ne dia wonye nyinara no enenso Erade adom yensa aka ya sister so bi ewo yentem ha we de bebo apini no na ya mana kwaba eba Zone 5 health line so ya sister ya mo kwaba eba Zone 5 health line
yeah aminia
we de udin
Pancho from
Portia
Amor.
What's your position in the health sector?
Okay, I'm a physiotherapist.
A physiotherapist. And who is a physiotherapist?
Okay. For the people to understand this so briefly, physio for ye in Kofwa, Yabua, wana wihiamwa in a way that you apply medication.
Oh, okay.
So as you say, you use physical activities,
okay,
such as exercise, and also some few things like electrodes to help people out there without using medication. And that's a specific point. In fact, it drew and canipa. By say exercise. And
wow. So, viewers, when we are talking about physiotherapists, a physiotherapist is a person who doesn't use medication, but on their own use your grown fan count. They will treat you with exercise and physical means that a radiator hope at all. Until when fed dropping my count, I don't any side effect. So, well, Sister Portia, yes, I'm our crab you about Zone 5 health line. So,
yeah, really.
See, watch a Juma physiotherapist, I can't obey a physiotherapist that quiet. Obi uma maybe cry to with you, any man. Yet, me and you will a hot a physiotherapist says, but no watch I am a Juma portia, moye. Nanda the other punty, you be discuss it, a stroke. Stroke area can obi you machine e wo fie memo aye mu show but at the end of this program no Erade adom obeti bibia ase e mo wa ye okay de ebe ye nyina no obeti ase wa bi antiposure wa bi na unim emude no then stroke
say a stroke
okay
so scientifically no and profobin as CVA. Send your baby bema or multibrofonium or multichin enya the American scientifically no.
Okay.
For friend is CVA.
CVA. Oh, okay.
Okay. That's the initials.
Okay.
Means cerebrovascular accident. That's for the physio. Cerebrovascular accident.
Cerebrovascular accident. That is CVA.
Okay.
Oh, okay.
And for us to make our viewers understand it more clearly, no. So a stroke is an attack on the brain. To make it simple, this is about the vessels.
Oh, okay.
Yes. So when there is an attack on the brain, to make it simple for our viewers to understand, when there is an attack on the brain, that's for the stroke.
So basically, when you talk about stroke, attack the blood vessels, you know,
enya chimato bi wo adwen ni mu so what you say enya chimato bi wo adwen ni mu a eno na ye frɛ no stroke and I say CVA
see din kakra ni nyina stroke nti
kakra ni nyina no
okay so abribia because in our society mostly ehu nkrofo a enya bi in our society be yetan hu pa nti obi a mehu ni bia se wanya stroke bia na wanya sa cardiovascular accident obi a wanya bia ye to timi a ato e won tini mu ana
yes
na stroke na bosu ti say
stroke na nkasa no say ka stroke na ye fancy ya fane kakaka ni nyina
okay
ba ye wo mu mielo
okay
so what you say ye wo stroke ni mu mielo ye ba ye wo hemorrhagic stroke and ye wo ischemic stroke ischemic no ye say moja na di afusa na ekoya adwen ni mu no seem to be anase chimato bi aba ho intimi nko se ne wo se ekono
that is the ischemic stroke
ischemic no when there is a poor blood flow and I say there is a clot eno na ye ischemic no
nti te say minti mu te say minti se no na bibi asikwan as bibi asikwan no ene friend ischemic na
but one thing is enye intimi bia na mum de edi moja koma adwen no
so we have a specific blood vessels edi moja no koma adwen
no inti se enu mum hoto chima na se ne wo se moja ni di afusane no enko a enno ene de ischemic ne yede eba inti eno that means it's either there is a poor blood flow and now there is a clot it's two things say moja ni intimi di afusane it me koka baby and the koka baby one nso a eda na abobo ho inti be ma de wo se eba be silicon enya kwan enko ene wo bi ho nso a itimi ko de but not as normal as it's supposed to be say enko your friend say enko yie no enye sa na ye ba emum etwetwe si ananso say ekọ wa me fan to ni sa ekọ wa so eno na ye ischemic no
so when you talk about the ischemic stroke now any type of stroke hamana and as the blood vessel na moja femu kwa adwen no ho no clot BSc ni kwa ntumi nko ana se ekonya ena me nya ischemic stroke no oh okay and what about the hemorrhagic stroke no
okay so hemorrhagic stroke no and only say when there is a rupture within the blood vessels and no dey anya say moja ni ntimi nko ana se esikwan na mum ahoma bi ate de moja ni nemu na ate say it's no instead of say moja ni eko adwen mu dey epie free
na say pipe no
epie free so mostly when you read about stroke it's about bleeding a bleeding outside so that's for the hemorrhagic stroke no and no and yes a blood need to flow na mum baby okay you have say pipe it's moja no enko no e ba abonten eno na ye
oh wow where ubiye ni viewers said ya midi kan ka hwe wo no say on Zoom 5 hotline abribia no unya apomodin ni a waben iye utie conversation ye nu baby akora unse unti ase o ti ase de eba okay so briefly what is the difference between the two of them the ischemic stroke and the hemorrhagic stroke what's the difference
the differences ba kono say moja ni intimi nkom and ba kono so say moja ni epie free ahomane
okay
but dear insunsanso e de ba de na mostly no the same na emu ba ko say moja no intimi ndru ba bi adwen ni say ewo no and ba kono so say moja ni epie free ahomana efemu no epa abonten
oh wow actually inti bibisa bi o eden na ede what causes it
stroke there nyame nim no kware ni stroke there enema be pray but ye wade ba ko bia number one factor
okay
that is hypertension the
enemy
ya moja so eno ni ade ba ko bia like obi na want ni am manage hu ya e be kwa stroke aba it is a wo hwe stroke ade ba ko pe like so wo kan anasa o kan bi afa adwemu ha ho ade ba ko pe no motai de ba no hypertension and no the major risk factor to stroke.
So which means when we are talking about stroke, we don't have a particular cause.
No.
But we have predisposing factors or risk factors. So they can kind of.
Oh yeah, a bit near my wide.
No one more back on hypertension.
Yes.
And in our society too, one of the living or one of the leading medical say prior hypertension.
Yes. Yes. Anything no. So what kind of first stroke we are? Because and also the most second cause and no Emma see.
Oh, okay.
Yes,
stroke.
Because of hypertension. It was any boy bra. And I will share my immune hypertension need doors. So we need pattern especially at the age of 40 going now. Obet me say out of 8 in the best 7 hypertension. So that's it.
So is there any other causes again?
Oh, we have a lot. We have genetic factors. And only I say we busuemono. Who be when you be. When you stroke ni bida and no was so show who ye yes I won so no ubenya bi yes so obusuemu obi enya stroke ni bia na say or free obusuemu dey was so show who ye because the possibilities are also benya bi and I said the percentage you know very high.
Why?
Think your friend genetics mujamu ade
say example mama and papa will be a man shame we are
na nyo mama mpo onanampo see, I know the young mammy. You can't say the mammy because so mammy na when you say on another mammy, so and family anymore. And I moja bakona iti. Say, obinya stroke, a will fear. Nasa work will be there. And was also or show who yes, higher risk also there. Obey
I show you no viewers, I show you no, even about threat. Na ya bo muye pa, said ya, I show you. Yet me actually you because if me hang many can stroke idea in our society na idea ha among you pa and they say if a family member or to me be there so if I'm at rest there and they be because and when you physiotherapist where you manage those prevention one China against or boho by and when you about try as I share I didn't tell more boho ye so ye pa there am I okay so the risk factors we have talked about hypertension, genetic factors now kind of.
Yeah.
And then what again? Do we have any?
Cholesterol. Cholesterol. When your cholesterol level is high, and also yes, or like ubitini NMB, and now obia or live a sedentary lifestyle, which is one of adia. And what say you hit it on
sedentary lifestyle? I hear the way.
Okay, so sedentary lifestyle they say obi oha on exercise say on balancing the food the obenya bia odi so what you say odi we nso a we no akwakoda or sorry the miss like the same agenda and or carry out on sorry on like on nanti or suma obi ni made ofie on we aduane ma no osini ne ma no or one conform ye ni bia to the sense or obi a driving a car ejuma oko or we are better air condition 24/7. That's what we call sedentary lifestyle. I won't talk, but I won't talk too much and it's no and the problem ever. And that's the sedentary lifestyle.
Oh, okay. Okay, or repeats, you know. Not stand there condition.
Not there condition.
A bit to me, I'm an stroke.
Oh, uncle baby, or dampem, no hating, no DD. That's all that he or she can do. She will not go out, she will not do anything for herself or he. So as I say, they don't do anything. That's the sedentary lifestyle we are talking about.
Okay. Today. So what about can stress also be part of the risk factors? Stress.
Okay. Scientifically or medically, no. Yeah, first stress and
okay.
But and also because when you are stressed out, pressure. I say the obi stress, very stressed. Akumani bo king. And I say akumani bo gidigidia. It should tell you say mojane dia fusane ko umojani. Yes, say I was say
your rate be as a more than normal.
Yes, the rate of which are ABT faster no. Too much. And also bet me cause a problem. That's what I'm saying. It's a medically, and that's a scientifically and can say stress. Okay. But when they say stress in this and your marketing, it's added to one factor B. And so ultimately stroke no.
So basically, So one really is stress, hypertension, those lifestyles are oh yeah, no exercise,
diabetes.
Oh, diabetes also part.
All of them, diabetes, hypertension, genetics, and maybe accidents. That's why when we read your friend say the initials on the CV in an accident, accident. Ubetini enya accident na uti abo. So it can cause it and all that.
Ubetumi enya accident ema and also akose. Where you think you know tiawa na yintwa ya homra. Ya ba ya de ya ho so ebetua so kan ho. Abra yintwa ya ho abe. Esama makwa babio eba zone 5 health line so where you go try and tie wa esamba baby fefe amohwe we are live in Nungwa Junction Mall inside Sweet Roses. Yes, it was Sweet Roses was Nungwa Junction Mall no pe wa hwe bibi fefe ne place aye when how environment in it ya unze me chire na me feel pa. If you are out there and you are watching, you can pass by with your family, one or wife ukunu oma wabushia no ba mo ba ha those assorted rice, Chinese food, Chinese soups, smoothies, drinks and other things that wow ba ube feel you can just pass by. Okay, today as we all know, we are discussing stroke. Na your sister Portia or a physiotherapist and a discussion no what their stroke and what the causes nyama and as the risk factors are yebe hu a betumi the stroke na there abrenti risk factors ni bi na boss yes be hypertension, diabetes, genetic factors say family history say family history of stroke then I say to me take precaution pass because one thing you betumi there enya stroke ni bi we are still on the risk factors no enti antiposia na wo kan risk factors no enti no about hypertension, family history, other stress and other things. Or diabetes so.
Yeah.
So how can diabetes be a risk factor to
you know, when it comes to stroke, we are talking about blood here.
Okay.
So what you say? And your friend is saying, you can't about diabetes. It's also about blood. Okay. And I say sugar level, glucose level, cholesterol. Enti nimina ka ho bi nipadua nankasa na bibi o ha se ba kuto chima no so lead to other things.
Okay.
So your for diabetes na a very broad topic on its own. But say emre any ho nti no. Ye bebo boso ama nipa hu se o diabetes na se one manage ni ya. No so to me the stroke ni ye den. Eba. Me ye sure say emre ma ye kwan a die beba for you beba because much about it.
Oh, okay. So now we have known the what do you call the causes and everything. Okay, so what are the signs? Because what can is ischemic stroke and hemorrhagic stroke? What are the signs that obi as a bit here? Me who say when you stroke maybe.
Okay, so signs need a baby, and I always use medically because after this program, and for visiting maybe Google or other page, send a be on the reading much about it. So you can okay, we have ya buanu egua some we call it FAST, FAST.
Okay.
FAST. And I know F ni jina man FAST as in fast.
Fast. Oh, okay.
FAST fast. Say over F na ejina man say face drop. On say the muscles on the face no. On say I am right. Obi o ha enyo obi an go through that. But obi o ha bon say all of a sudden obi that so obi say na no achia akodi fa kakra. I know na face drop no.
Oh, okay.
Na fe yaba A no. And only so you say, and son, there is a weakness, arm weakness. It's either both or one. Obi better sorry, na ninsa way, you know, and also I am or muscle cry and ma. So and also homa arm weakness.
Okay, before you go to the next X, about the A, because I've seen such occurrences and situations before.
Oh, okay.
Obuha ne ha na both arm ni no ntumi raise. Adenti no obuha etumi nya ne half. And obuha nso a etumi nya ne full ni nyina.
Hey, before we go to that though, it's an person make sure science, you know.
Okay, then finish first. Okay,
yeah,
then finish
we'll
first.
go that. Okay, so Eba and no say na make I drew the A so arm weakness. Then I call S no speech impairment.
Okay.
Obi on half a or kasa cry and back. Hey or kasa and back. And at it's time for you to call ambulance, and I say any health you just have to call them fast. Send your beya or move coming into it. Okay, so concerning the question, say question
someone and a half and I do both and full.
Okay, so brain, you being a health personnel, brain when you say you walk in Chichemu.
Okay.
So stroking, it depends on the kind of blood vessels na atochimano.
Arab channel.
Good. It is a equity right na. So right ventricle near any problem. And no sign never say on left side no weakness any. And there will be also I said left side of the brain no etochima or right side of the body no. And also na etochima.
So which means if the part of the brain that controls my right side, the organs and the organs in the right side and is the one that is affected, which means I become a right. Yes. But if a rupture, maybe the senses or the part of the brain that control both, then I'll have both.
Yes.
Wow.
Okay. Over here will be paraplegia and those things, you know, because if you have a fan on one side, you also cry a fat. Only the lower limbs, you know, and not upper limbs. Okay, obi your horn swat a fat upper limbs, you know, not lower limbs. But we should take note of this. And your paralysis be a stroke.
Okay.
And your paralysis. It is all say obi ebubugu baby as you when your stroke. And your paralysis be a stroke because when you have a problem with the spinal cord, that's the C4, C5, C6, and also to me the paralysis. But we should take note of that.
Okay. So. And yes, so be a buato. Now, when you're stroke, there be, and yes, Nabotre, and in the Nabotrena, yet true, and one. It's a more science and science and not my some abbreviations be FAST. Fast. And what I said, the F stand for face drop, the A stand for weakness in the arm weakness, and the S stand for speech impairment. And the T stand for like call for help or ambulance or something.
It's time for you to call
for help.
To
call for help.
Yes.
Oh, okay. So this is the abbreviation, but
but
more. Say you'll be useful when we be for beer.
Okay, so stroke no estatia and as a CVA eba bestatia. Oh ha, unsimu yo titiriti crofo yo almost anansi achi omo.
Yeah, in our society, that is one of the normal ways. Oh, Anansi Achimi. Anansi Sunye police, but they be Anansi chair.
Yes. Anansi Achimi, there be. So, I know one thing, the Nancy to and now, or balance. I did taking notice of it. You ever say first, and the same thing, and say first test way so faster. But this time around, I take a crowd break, and I say, oh,
or sideways.
And also a dear barco. And also say hypertension the major
risk factor.
And take a canoa kumano, a book kiki, blood visions, and your friend is saying, like, why now only pedian or being in pedia city into as a son. Or what's a weird day? Obu hospital or how who say be beating na name or she name it's a sign or an say be bold
in Kaya
say this is what a person is bravo, so you have to work on it fast. So and these are the small things that I can say about it. That is Anansi no any onemu yo titiriti bibi ni na monemu o feeling weakness be was some part of the body and I say like o kwa o balance no kwa unko yie unanti yie o kwa fa.
Okay, viewers, our sister is really educating us, but as we all say, Zone 5 Health Line, we don't support self-medication. Ain't don't sit at home. Then can say, oh, me who we are, so me who we are when you're stroke. You are not a health practitioner, or you are not the right person to diagnose the patient or a particular person say when you're stroke. It is similar to create awareness. Never nearby a hoso. It is a sa insencheni we ya tumirikan tem kwa ya rasabia. Ya ten unko chere munchera kwesi mansa. Anadwa mensa. No nka se minim eduro bi eda no ma me bi ye we no. Eduro bi wo nte so beje bi da bi tumirikana kwa ayaresabia. Okay, so that is the symptoms now. The signs is sure.
We hear so beba hospital to know. Wow, we show who na who sani ma we ya. But who show who na who bibi say ya. Hey, who dey ayen say oh menya stroke daddy. Because we have other conditions as well and also signs and so the same. It would so who bibi sa go to the hospital near a thorough checkup on you then to confirm say oh stroke and I say maybe it's a different
it's a different thing all together. Oh, okay. So, as what try in training, how do you people diagnose it? How is the diagnosis done?
Oh, okay. So,
and the symptoms and the diagnosis. How is it?
Okay. So, when you come to our physio department, first, no matter first we will ask of the AL.
Okay.
Then you will tell us how you feel, what is going on, because when you only pedia now you're there. Then after that, so we have some specific things. You measure muscle size, muscle strength. Yes, and all that. We have our way, which say you can see a true Okay, so we compare sizes and now say we compare. You can say yes, your bedding can show.
Family example.
Okay, so your bedding can show.
Okay.
You be someone no same year. Oh, and then you know can be say I mean sunny fano. Oh, me who say I say ya. Then you be more page on sunny fana me ashe.
When my page says
dear who feel say I get affected no. Me ashe baby a bit me drew me the measure ahoden wo.
So wo of page and say obu so say obu oh.
Na fe ya you be compare your friend is saying baby I am ready to baby
normal no.
Enti baby enu ni betumi adru na afi ya ma we no so aye. Enti sentini endru a ene ye be categorizing say bia we do 5 because you measure up to 5, we do 5, we do 3, we do 2 and na say bibisa. And a muscle stone. So obinya stroke now o don sa so ni padua ni ma. O feel weakness, o feel say as a memory kakra and also to determine the muscle tone. So we have a way which I know they need to make it kind of very entry because we have a na ebia wakonya different result or different
thing altogether. So the skin and how measures before that do you have stages in stroke? More stages woman.
Okay. For stroke, they need stages, but we have an acute and we have chronic. Obi oha onya no, like and chebia no ba hospital. So I just obi also what's if you hear about, but the situation become worse and sana waba hospital. So a check bro 3 months corner, you're classified as chronic, but say you within a week 2 hours onya na waba acute.
Okay, so the acute and the chronic state. Okay, young me sweet yawa na intwa your homra. Yeba the treatment and how the physio people treat the patients and the advice and other things, you know. You try home ba yeba trauma so. Can who say when you go so ahwe Zone 5 Health Line or some for Richmond Tete and I media wuchi ame. And your sister ayere kasa sister Portia and yede na ewa hai physiotherapist by profession. You try your home. Yakoba, Elios Vetros. welcome back from the commercial break. As we were discussing stroke. Now we have known what stroke is. You who their stroke you who the sign, the symptoms, the risk factors. You know you who your sister Portia or your physiotherapist and you need this and come on. You just say what be a pana ocean some neighbor and in Chirumu said the corner when you are jihu pa. Now she will be sure you will share your sweet roses, or Nungwa Janshimo. The Nungwa Janshimo by Nungwa barrier, Janshimo. Then you look for sweet roses. One casaba and the family bar. You have the family package, just a wife couples package, we be out by one gas whenever G pa. Whether you're to young come up to so we are still on the topic stroke. It's a bush now, you can't stroke, you know, you can't. It's watch their stroke here, watching the risk factors, watching the signs, the symptoms are more physiotherapists who start more share who say and more confirm say it's true. So and then we are also on the diagnosis. So the diagnosis, you know, let's hammer more on that. Okay.
I'll say yes, starting on. Yes, it can be said we have 2 types of stroke. Okay. Which is hemorrhagic and ischemic. And so when walking into your physiotherapy department, you wouldn't know whether it's hemorrhagic or ischemic. Okay. Unless say ni pana kwakoye MRI.
Oh, okay.
So what you say? And no nebe detect to say or stroke name or this type of stroke. And ye to mean decide say me show 90 year old baby or ischemic. And I'm sure 90 year about hemorrhagic. No, it's not done that way. It's your it would make a CT scan, it be a blood test, it be a MRI and all that. Into say no which is the physical assessment now. And only bit me.
More rely on those diagnostics people no and medical laboratory people
and no na
to confirm.
So we do our physical assessments and also share the imaging side.
Also magnetic resonance imaging. Oh, okay. Okay, mo hwɛ ni nyina na mo de ehu say into okay. Okay, the patient aba. My request for those magnetic resonance imaging, other CT scan and laboratory investigation. Yes, or the aba. How will you distinguish between ischemic and hemorrhagic stroke?
Oh, when the bacteria, you can say results no they no a bacteria. It's na make us say yet to me show appearance and I said the dear room no and determine say this type of stroke. Okay. Because we don't see beyond of physical appearance, but machine no share a gene anymore. It's a bit determine and that's a bit detect to say, oh, this blood vessels are not this thing na anya a chin to an say simatobi. It's in way na ni pano. It's an only one my juma because physical assessment. You won't say there is a problem, but a DNA cause problem no. Imagine never try at the property cause.
Oh, okay. Which means that the health sector no we way and we say the way. Oh, okay. So now that we are done with the diagnosis, okay. Now the patient has walked in or acquire the necessary investigation. More confirm it. Say when maybe ischemic or hemorrhagic stroke. So in physio, what's the next process? I remember here. What's the next process?
All right. So Senipani walking in, why are all the necessary things for us to know this is okay? What is wrong? What is wrong and all that now. Then we take it to the next step, which the next step is say a hypertension, stroke nearby, and also cholesterol. First, what the doctor will do is to manage that kind of condition. You don't just start the physio. Okay. And what's say manage at the end air course, because once a mojamro so say command pano any vigorous activity and also can bring another issue altogether. And the doctor no ebemano a draw and abibia ebema whatever that was causing the problem no be there. Ebeba from to say o man a draw man ultimately manage causes now. Then we will come in with you be designing some exercises for you depending on idea you who will need pedria. maybe you might see a person, let's say me or ischemic or ischemic. You know, a stroke patient here, but all exercise between different from the other person. Because maybe I'm on muscle power no nim a single. And I say also muscle power no nim a single. You show a who day. You schedule between you need design some exercise for you.
So whilst the medical officer is maybe fighting to suppress the risk factor, no, then on before you people also come in. Into one but you don't just sit down to assign or design the exercise for the patient.
No.
But it depends on the strength.
The strength, what you can do, what you cannot do, and all that before we can design some particular exercise.
And what are some of the designs?
Oh, with exercise, no. That's what I'm saying. Say it will be very difficult. Some pinpoint to say, oh, kofa exercise way. We have these are the types of exercise. Let me put it in this category. We have strengthening exercise. It's no baby and muscle power no and that's how they know from no. By using maybe dumbbell, like
dumbbell now the gym ni binana.
The gym yes. I also gym for no more use this and be on the ball. Yes, yeah, the exercise say we have stretching, but it depends if there is a tightness. Baby, even massage too is part because especially when there is a facial paralysis. I know that you're more man. We do some massage, send a muscle tone and some power. So we have a lot of things that we do for people out there. But unless you come in, and our patients be out when they exercise or be out there different. It's not like one exercise for everybody when you're true. So unless we see you, we are designing something specifically for you and sana. Yeah, to us so every home.
No, okay, so viewers, what their sister no can. She's a certified physiotherapist. Or say on to me and tenase and can say we de kojo man exercise we enti komra enso man exercise we there be esun bia ne de exercise ye de ma no eti maybe obuhwe bi ko ye ne se anka so oh me papa kura no onya bi no star wo ye no kura me hu ibi nti me so the same thing me fa so there be wo ba ye hwew pa ho oden wo nim de wo ba ye a wo ba hwe wo be hu na wa hwe so no wo de aden wo de ahwe wo so wo de intimate na fie. We repeat, don't do self-medication. Never do self-medication. Okay, I want you to give me one example. Maybe example, say why assessment on one patient. Say we say so and design one exercise for the patient for me.
Oh, okay. So Yanfane Sobi was true. Then sa Ben Kumana say the fano atuchima.
Okay.
Okay, yes, one of the upper limb, no. There is a weakness. What we will do is we call something TheraBand.
Okay.
The entire maker TheraBand. They say TheraBand. We bet to be at to fear because mostly we use pulley. We have hand pulley. I was so watching now the coffin at the bastro. Maker TheraBand no is because TheraBand near you can walk to any shop or motor physio accessories. Now I be yet to set tie. Over hanging over baby. Now don't sana shim. Then you pull it down, up. So, until the more you are doing it, the consistency you are, it brings out the strength. So what you're saying, but one thing about physio is, it's not a day job. Please, let's take note of it. It's not a day job. Or we how about physio? No, if you say, papa, done, we are done. No. Or we how to me about physio, we stroke, or bet me the bare 4 months. Yes, 4 months and so on. And you know, be also be our recovery process. Or bet me about within 3 weeks, we fast improvement. Or also bet me about 6 months. Maybe any is slow, but there is an assurance. Say by the time I will be free home, and also you better discharge you from physio. No? You should be better. If say situation in your chronic, now you're acute, you should be better.
Oh, okay. And me the umzemetia the viewers no ntina metia we be can say physio for no oba mo ha mo cha do bo ko baby I want when you would ni hyɛdan mu wo pun ya no de nyama bɔno bo say intente wo say na mo de ba mo yɛ no bɔkɔbɔkɔ ma ono do how about that one?
Say doctor ma o dra when they give you medication or share your side effects.
Okay.
And I say if say we prawachi oya and I say o pain o take painkiller instant on a pain here dey echo but
there is a side effect.
And the side effect in go and like painkiller no anko kill cause
no
e share my pain ko form
back
if free mo pena the pain no
Asamba.
But one thing about physio is so ho to wa ho ato there is no going back or turning back. So what you say it take it time anything good be ano and back gidi and na yare na ebo no and take it one day when I who say oh just one day me don't sorry na me fainting no abon ka ye da but out of ignorance what now ma afi na like well once I should go to the hospital so you shouldn't expect say physio you know magic within a day. It takes time. Yeah, the physical activities and exercise and all that. And gym build your muscles. You can ask them, it's not a one day job. It takes time. But one thing is when your time no now nya botere now to me na hotowa what to me looking like when you are
Okay, and let me ask this question also. Is most of the people no or is it when you are be and says and be na hand problem and be no or so kwata mame wo ntafo say if you have heard that issue before say ntafo na etwensa etwenti on instead of also on call ntafo na betwen like obetuma atwetwe ne ntema ma na akọ. How is your take as a physiotherapist? How's your take on this one too?
Ayampa Ukrainians as same way higher pa because we call wesin na normally abraye. That's what we are going through. I had this client
okay
na ha and the shoulder so oba you know we did some stimulation and some other stuff and a pain no a call but opeso took quite open internal call so obi a trainer you say the papa be or very good at those stuff and all coy so nipa no coy ni or the herbal call apply on the shoulder and pulling inside no knowing say we pulling and shoulder joints na year frame I feel okay na inside sense
where ye the joints and socket where you one back everywhere.
I feel crying something or do make about physio and I won't say no say you at me at the shame back any the shame says here no just normal shoulder pain no what I call we're saying is see when your problem and I say we show that you free ma it's a day or has a one working on later sometimes to me that's so crowd that's sorry na oh, it's what we're saying case, you know. We've had such baby or back no copim, no asaba. Oh, we are there. That's what I was saying. Say when the issue is an acute, and not the recovery process near very fast. But what they call ne kwaya chronic na uba in native physio.
Oh, okay. And let me ask also this question. Who's a stroke patient? I mean, who I've seen most of the stroke patients. I didn't know. What can say? I do mad. And yet, in dinner one I broke it. But you be a reaper. What on sack can I not come? What on sack water and sack can happen? Okay, come. Like they are so sensitive. What on sack can I depend here more? I didn't ever say so.
Also, when we were talking, you helped me out with it. Okay, say. It depends on baby affected. It may affect sometimes. Brain will controlling or nantie. Baby will controlling maybe will touch this and this and that. Obi a honya stroke na. Opa fa pin e wono.
Onte, obi something.
Obi also I am very hypersensitive. O can kitu ebi ana se bibi ni nam ni mu obey. But as time goes on, I am working on the course. No, ni na and stop it kwana e bafom. It wouldn't be as it was before.
It wouldn't be as it was before. Okay, young me so tiawa yeba ibeka nyamani nyina advisor ene the process say we nyina no ye de atudwa amo yetwa ye ho ye kwaba. akwaba eba dwumadi ne so ebio ye kwoswa discuss about stroke me jedi pan say uchia de eyi pan e wo fie ana ba bibiara wadwuma ba bibiara wo a wo hwe bia no me jedi pan say uchia de yi pa you are learning a lot opportunity unya but when you utilize it afa ma wonua o ma me o papa bi say ye nyina yetumi tena say ni advice ye ho ni enya enough education we say a ankanya mo wonyina so beti ama yare we bi nye dey ensa ma ye nchen ebio enti na ye kasa about the diagnosis, how it is done by a physiotherapist, how we treat na wo hwe ni nyina no. Okay, treatment no bibi wo bio physiotherapist mo ye aye nim na obasi hu ana
okay, so what I can you see a use for exercise. It's not only exercising. We have electro pattern so
okay.
Says send your can do I don't sakana and you to me for exercise no any pain on your day.
Nice one. I was about to ask.
Yes. So we have electro side in which we have infrared, we have ultrasound. And your ultrasound now on your we have pain relief ultrasound. We have TENS machines and and also for pain relief. So we have pain relief side in here. So after say you day pain everyone, then we will come into the aspect of exercise, because so be feeling pain, you don't expect that person to on your exercise. Until say pain no best subside day and ever form kakra.
What be many wa high panty. He said stroke patient will fee. No I can say and our man so no so flipping out. I've seen some before. The reason why I'm so sensitive and much about this issue, I don't want to say it, but physically, my share stroke patient, many be at now, I should be paying because and I pay down some also Kenya on kakre. No pay no kikem or bread
pain
no catch and say, oh yeah, oh my was asked to me and it's a hotel, but oh, cherry and say yes, sir. You have to move kwanya, move to me pains, you know. If you before as a man exercise.
Yes.
Yes, you are worsening the case of the person.
Like it's not like you are worsening it. Sometimes for you to help somebody, and yet about enforcing some things on them. Okay. I was saying like even I was saying kind psyche ni panel. Or educating the panel psyche no. When some friendship, some relationship with a client. After that, oh hey fanega oh me do sometimes the other better or cry and you be pain no. One say yes see recovery process na says one person who started from the brain.
Okay.
It's we feel na oh me do tired oh feel the pain in you. The thing no didn't take the pain away. But how can I change it?
No.
Or feeling like they are so unqualified, the pain is gone and I'm packed. That pain is gone. It's because when you pain then when you see that Nipano is not going through that pain, not too much severe pain, then you come to the exercise aspect. Because me in a way I think I'm healthy, Me feel pain beyond catch him sending exercise. I'm not going to do it until the pain is gone.
The pain is gone before okay, unless the pain is gone. So that is the treatment. The diagnosis aspect and the treatment aspect. Mo treat one. Now, kwanya more fast more show. And we are doing
I can't physio and but one thing they know as about is stroke fall. And I said, don't pay for
because these are the unsound heroes in the healthcare. But because we should know where say me treat you without medicine.
It's not easy.
It's easy. Okay. So, yeah, but said ya unim na unim said ya kwanya faso ade be. How in the root factor? What is the advice? Then what should we do?
Okay, advice I'm the viewers out there and say we shouldn't be comfortable with whatever that we do.
Okay.
And that's it, and what say? Like time to time we should exercise. I want to say this before I go. So we will be gym, it's different from normal exercise. We want to say, oh, me will be a gym pan so. Gym or person
no. Gym when you exercise.
ko gym ko pagya da dia won exercise so
viewers ya wotre enti ka zone 5 hotline e be nya abotre bubu nsem nim na wate ase once abri bia no ye ne obi atena sa ye nya big point bro bi e be fam ti haye wa wo pagya da de ntie o say that
so obi o ha ko gym say okoye exercise like up person look fit and only different from omo especially our guys no more gym no mo pagya that they send be on benya bulky muscles and all that
ti say me de no
oyo obi a say yeah oko gym ko pagya and can say o pagya that dey no
o exercise
because say o person working on the heart yen fa that dey pagya Encore working on the heart. We have cardio exercise, which is the using of the treadmill or comrika, send a baby strengthen the heart. So what you say?
Teacher say akoma exercise ni ye. Mo wa dia mo de ma akoma. Adwe mo de mo de ma no. Ensa de obi an na de.
And don't just go to the gym because you feel like me person me say. And before you go to the gym, no make sure so we instructor papa be on show baby because we've come across plenty cases of me call gym no akowada ho.
Okay.
So as I say, obi ho hypertension, hanu akohwere gymnasty treadmill so papa na kuma na eba na wa fainty okọ. Even I think our vice president, our former vice president, same thing happened to him. It's before you, it's like you recommend they say do a thorough checkup.
See a professional.
Yes, first making sure so maybe we'll check your BP, so as I say, blood pressure to know whether you are okay for that kind of exercise that you are about to do. It's not like you just walk to the gym. Maybe you are going for a different purpose. And when you go to the gym, Nippon so a professional design is something for you or by your cardio and when you do cycling, it's all part of the cardio exercise. But you don't just go there. Be lifting heavy machines and heavy metals and all that and be thinking say oh me I'm fit I'm this I'm that. I have a lot of gym on page about back pain obi how to make there is a tail of the like your friend is saying the vessels no aba so what you say so please me poucho just see a professional media. That's my advice for you. See a professional in case you see any sign. See a professional. And another thing is, we have some few stuff that you can be doing yourself. Okay. Google and also YouTuber. You can see some small, basic exercises. I will bet me a follow. But making sure that then I will so a challenge you who are doing too much. Don't do it. Making sure say although say you are not that too comfortable, but you are okay. Obi wa ha wo say say wo video nim no and we bia no be. You might cause a harm and I say it can cause a harm to you. So that's my advice for you.
Okay. For we yemfa we example boy en kakra wa ha. They say obi o hypertension. And obi we nya stroke and other condition no wo fie na wadidi amen. Kire tiawa exercise bi o wo fie so ye. But me na simple bi.
Say or you'll be like you will be all hypertension.
Yes,
now say walking and then you're walking say 2-9 back we have fast walking be there. Oh, it is say what die now woman no. It's really but say ebia when you soon a bit you and you're around now be corner when you so a bit brew and I say bit oko see now aba kakra to work on the heart. So what you say send a be calm down.
And for hypertension, no, we say, yeah, did we did the same exercise. Exercise when
we don't do that.
Yeah.
You don't have to eat right after eating quiet exercise. What do I now found really about that? We don't do that.
Now, we are so I need exercise BSM.
No, why should you do that? Making sure that relaxing and bra from kakra. Oh, maybe after 30 minutes or an hour, then you can start exercising.
Mekai po we did wa me was won wurifiri but the aduana is also wurifiri about
ni pa no kuno
pra no yani ekuya ho ekuya ho pa nti we did me ya wurifiri
no ye wo dey relax kakra na enko on say wo didi after about 30 minutes who ni say aba from kakra then anase an then you can start exercising. But Kodidi enko. Akodi banku ne nkwan na ko hwehwe.
Wow. Okay, then let me ask this question. Who said traditionally what's it? Stroke who say adwuma asem. Inte say exercise ade adwene. Where do we bisa? Who say e we aduan bi aye ti say maize and groundnut. Broncheria, twi e friend broncheria and a maize, normal maize. Also we there then pan I was na unti sorry. Inte say much exercise. So how do you take that one also?
Oh, okay. I think I understand where you are coming from because we the physios in no more facial paralysis and you will chewing gum be higher the more or more strengthening the gum the cheeks in it all that no. Hey, be another replacing the weight in Nigeria, but for the Nigerian aspect in it, dear.
Because I know wa pantine and how say exercising we always say why exercise pa
it's in America say like replace it with chewing gum you chewing gum be the more send e be ya nipa no or be strengthen the muscles na woni but say me korean chewing gum fanta I really mean to me
but chewing gum no can enye normal chewing gum
no we have
ko to ayi say ana who say stroke patient and so how me man wan de bi na omiemia eno so ya de ade
also be I have a client when you are stroke in his ano ne nsa ba ko aye say ontimi nye ne say
okay
ba ko so aye say age e biem nti we have some ball be ye de share ne so na be bie ne nsa nim and we have some ball be also the way be squeeze say na be to insanity. And before say ever prescribe a bone, maybe you have a condition I will say here
sabon and somebody sabon. Oh, okay. Anna stroke stroke patient be wo treating what they have ban shane san ha no what the bandage chichire no hu nyina and also was say esa na ndu nu wura body ni ma obeyina and also how do you take it?
Okay, as I said, in your department, and as in your physio for na and only a herbal aspect, no, and I mean to be condemned, it will be a juma.
Oh, there be we are not, but does it have effects?
I mean, try be that though,
okay.
And me who will be a working money that so was say there. All those we see on TV, and they are dancing and I'm stroke na me who told me and I say that side there. But me, the advice I'll give it to people out there, say, in case a family member is going through that problem, please and just take the person to the hospital. That's the correct thing to do.
That is the correct thing to do. Oh, okay. We have learned a lot about stroke and our physiotherapist and Yabotre 111. Bijedi said the abu say wote and the abu say uhu nyina no wo hu ate enti what bibia ase your last OS assembly na woma viewers.
My last words to the people out there is we should be careful of what we take in.
Okay.
That's the most important thing. We should be careful of what we take in because it can cause so many harm to us.
No. Oh wow. Okay. So we say onwachira kwan ya. You say obetuno na ma atudwa.
All right.
For some advices and other things.
0249 64 54 87 0249 64 54 87. Obetimi afre at any time. Open any assistance, any advice, anything. Me what tema. Obetimi afre me at any time.
No. Okay. So such an interesting episode. Yene, our physiotherapist, the name was Portia Amo. Yene netinasi ya. Or a certified physiotherapist. And yene netinasi you didn't come out about stroke. Majority say you have been educated about stroke. All that you need to know. No, when we na what he say in some social kasibia enye hu bia no onya botre say hu ni ntem na ba won chan ya obesa na 100% obenya botre enya ho time asa no 100%. Iti ha ene de stroke discussion ni nyina ABC bia fefefe ya mo amu yi we catch am say ye interview na bia we ye wo sweet roses sweet roses inside Nungwa Junction Mall where smoothies, drinks, Chinese foods, assorted rices and everything. I will pay beyond say Obaha on sa ebeka. That's it. Say Uji penny a you are watching a Zoom 5 health line. We'll be here. Wait to visit here on our website. YouTube. I'll everything done video. So YouTube the name is Zoom 5 Television. Zone 5. Zone is ZONE, then 5. Then you type television. You see this program and the egg can win na Uko Facebook unsuya. The Facebook name is Zone 5 Media GH. Zone 5 Media GH. And so to me follow you. One like the videos are yere to win na. Uko Instagram. Instagram is Zone 5 TV. Zone 5 TV. That one is not television but TV. TikTok and so is Zone 5 TV. TikTok Zone 5 TV. Besides this will be wait me who YouTube. YouTube nya enchire bi enya YouTube I did test sort. Name YouTube channel near Zone 5 Television. Zone 5 Television. You subscribe, you share so that you join this big family. Then we all learn together. Or you can visit us at our website www.zone5mediagh.com. www.zone5mediagh.com. So you will see our upcoming programs, how their what is news, preachings, and health tips and other things. In same way, and as I say, okay, na issue yade. Young guest and so everybody Yankopon unshira ye pa say only embomu ebe chire adepa. Me special greetings, command directors and my executive producer, Mr. Prince AJ. Mr. Prince AJ. And I'm Mankasa. Me director ba kope ebi bia obi akojo edu esare erade enshira ye pa na me mama the welfare of the team mama Evelyn Jesus Christ enshira the production assistant Caleb Cranton Jesus Christ enshira mu nyina say mu wo papa our head of IT Mr. Jason ye chia mu nyina the production team, you know, one of the ITs and our directors, Mr. Owusu, Yesu Ichirao, Michael, so production assistant, Yesu Christo, Ichira Munina, me and me did media which yami, and I'm a car no, now me directed, no, me did the rich one, Tete, where the and you media in ABC, ya crowd, that's it, bye bye.